This is Heart Rhythm TV, and I'm Dan Alyesh, here with an HRS in-depth discussion on a white paper, the ability of AI to revolutionize care in EP. And for that reason, I'm joined today by Dr. Sana Al-Khatib of Duke University. Welcome.
Thank you very much. Happy to be here.
Yeah. Well, I really enjoyed reading your paper. And I wanted just to dive into some of the points you make, which are very, very salient. For those people watching who are less familiar with AI, can you describe AI in its different components?
Yeah, no, absolutely. And before I do that, I do want to take a few seconds just to kind of highlight why we wrote this white paper in the first place. So like within the Heart Rhythm Society, there is definitely a priority to really focus on AI and digital health. And we felt that a white paper focusing on artificial intelligence in terms of its relationship with clinical practice, research, and education would be so important for our members, especially those members who are not doing a ton of work in AI, but also would set the stage for subsequent perspective papers that will also be published following this paper that tackle specific topics in more detail. And so I just wanted to make sure that people are aware of that. But with regard to AI, like many people say, well, what is machine learning? It is definitely a type of artificial intelligence that basically uses existing data, to create algorithms that then can be used to predict a disease, an outcome, response to therapy. The clinical applications, as you can see, are actually endless. They can be endless in my view. And so, yes, AI has been around for a very long time. The question is, how do we really optimize the use of AI, and how do we maximize the use of AI in all these sectors of our practice and research and education? That's what the paper actually tackles.
Absolutely. And I think you make a lot of great points about potential impact on clinical practice, on education, on research. An important point that you made, which I thought was very interesting, was there's administrative burden. There are issues with burnout in practice of medicine. So talk to me a little bit about AI and the potential implication for improving that burnout.
Yeah, no, absolutely. So if you think of the different applications, or at least potential applications of AI, I mean, the sky is the limit in terms of what things that now clinicians or administrators who support these clinicians today can actually be assigned to AI models, algorithms that can help with scheduling patients, responding to patients, messages, things like that through Epic. The fact that now all practices are using EMR is going to make this much easier to implement in terms of the AI. And so, in terms of administrative work, I would think a lot of it is scheduling, potentially notes, generating our notes when we see patients. If we're searching for information in a patient's chart, could that be used to kind of help us find the information more efficiently? So there are a lot of efficiencies that, in my mind, can be created through use of AI.
Yeah, very interesting points and great promise. The other point you make in the paper, which I thought was very interesting, is the ownership of healthcare data. It's complex, right?
Yes.
And then you add in AI. So what are some of those issues, and what are some of the ethical concerns around AI in that space?
Yeah, no, absolutely. I mean, this whole discussion about who owns the data is a very important one, right? Like we've debated this at HRX. I don't know if you had a chance to attend the two prior HRX meetings, but this is a topic that is absolutely on people's mind in terms of, who owns the data. And if, of course, the patient owns the data, I think we all agree. But, there are so many people who touch the data and modify the data as it moves from the patient to get imaging studies to the EMR, to then you store the data. And so there are many people and many entities that contribute to those data. And so that's why it is actually important to, yes, we recognize that the patient owns the data, and it is incumbent on us when we want to use the data, be it for clinical purposes or research purposes, to really be protecting the privacy and the confidentiality and be making sure that the data are put to good use. And so all of these things definitely need to be discussed, and we need to establish systems in place such that all the confidentiality, the privacy are protected, but that we are indeed trying to use the data to its full potential.
Well said, very well said. I think that there are sensitivities, and we need to establish norms and standards around that. So, medical education. You talk a little about potential implications in medical education. I absolutely love educating, and I think that's our future. So talk to me a little bit about the potential implications for AI in improving how we educate fellows.
Yeah, no, and that's a great point. And as you probably know, some fellows are already using AI. Like, many people go back to ChatGPT. They're using other things like that are facilitated by AI to learn. And now we're seeing a big surge in virtual reality models and platforms that people are using for training. And I think that's actually the future. I think we're going to continue to see more of that. And so the biggest thing for me is, of course, we want to innovate and we want to facilitate education. And I think the newer generations definitely love this form of learning and training, but there need to be safeguards in place. And what I mean by that is we need to make sure that while we do this, that our trainees are continuing to think on their own and be innovative, be creative. There needs to be oversight of the content. Like, yes, you have AI, but we need to make sure that the data that you input into the algorithms and the data generated by AI models, make sense, that they're evidence-based, that they're correct. Like, we can't say, okay, AI is going to take care of everything, and so there doesn't need to be oversight. Of course, there needs to be oversight.
Yes. I just want to, when I think about my patients, right, and they have something going on, something stressful, some event, sometimes they come see me in the office and they say, I just wanted to see you, right? And so that humanistic contact in healthcare. And so as we explore and expand AI, how do we protect that humanism and how do we enhance that humanism with our approach?
And this is such an important point that you brought up. And thank you so much for asking this question, because this is so key. It is important that as we innovate and as we start applying AI in different areas of our practice, that we do not forget about the importance of not just establishing, but maintaining this very special relationship with every patient. Otherwise, you lose a lot. Like, we all know one key to our ability to help patients is establishing that trust. And that takes time. And you can't do that with algorithms and AI models. That humanistic touch is going to continue to be very important. So, I personally cannot foresee a future where everything is going to be done through AI and through telehealth. I think that human touch will have to be preserved. And so that's why we need to be intentional about it, because we need to control AI and control these models, not be controlled by them.
Yeah, I think ideally, AI will be able to allow us to enhance our humanism, right?
I hope
Removing
so.
Administrative burdens, improving our ability to provide precision medicine, improving our ability to be present with our patients.
Absolutely.
That would be very ideal.
Yeah.
So as a final kind of question, you talk about in your paper that this is a primer for many other papers.
Yeah.
Kind of diving in deeper. So tell us a little bit more about what are your plans with this white paper series in AI?
Yeah, no, absolutely. So this is a white paper that is pretty broad. I mean, many people who looked at it and reviewed it said, well, this is really interesting and good, but it is broad. And we said, well, that was the intent, because we wanted to start really broad and then limit it and address certain topics in these perspective papers that you're alluding to. So these will also appear online, and there are different topics that are being covered. I am co-leading a paper with another author on bias in AI models and how do you prevent or address bias, which is a very important topic, as you can imagine, trying to avoid creating disparities through AI models and stuff. We have a paper about preserving humanism in medicine, despite the use of AI. And so that's another paper. There will be more emphasis on ownership of data and privacy and confidentiality, because that's really important. Another thing that we really tackle in our paper, probably in more detail than any other topic, is implementation of AI. How do you go about doing that? Because as you know, we've been talking about AI for years. But if you look at the pace at which health systems have indeed adopted AI models in their workflows, that has been pretty slow, and for many good reasons. And so in that paper, we talk more about implementation, and some of the prospective papers will touch more on some aspects of implementation as well.
Well, thank you very much, Sana. Great paper. And, viewers, you'll be able to see this in the comment section, a link to the paper. Thank you for joining me.
Of course, thank you.
And thank you all for tuning in to Heart Rhythm TV.